the second question, is this an airborne infection or droplet infection? You know, people notice that the virus affects big groups of people who can present in the same time, like maybe 40, 50, 60 people, and they all get infected. Other also have made comment on some animals like cat and tiger getting also infected by the virus. So some of them speculated that this could be an airborne rather than droplet infection. Can you please differentiate between both and tell us what you think, whether this is airborne or droplet infection? I think this could be answered by both, like Dr. Keith Siegel or Dr. Nicholas Vabre.
Okay, so I think that at the end of the day, airborne and droplets they are very it's somehow similar. So what the evidence show is that you can always have like a drop when you talk, when you cough. You generate continuously droplets that can incorporate some viral particles, and this, if it reach a point of entry in a non-infected individual, that would be for example, the mouse, it could start an infection. The question is what is the size of the droplet, minimal size of the droplet that can carry the virus, with the idea that the larger the droplets are, the least they would travel from the mouth of an infected individual to someone else. So I think that the question is, how do you define, at the end of the day, is how do you define airborne infections? Like how long the smallest droplet possible could stay in the air? And on this, we don't have a lot of data. There are a few studies that have evaluated how far away the virus could travel, and I think that the data was around like a few meters for the droplets that would be the most smallest and that could travel the farthest. So it's not an airborne infection in the sense it's not like it does not behave like a gas. It's not like soluble in air. It has to be inside of a drop that can be very small drops that can travel a significant distance.
Yeah, no, that I completely agree. I think a lot of the concern for this concern for this being an airborne infection is largely stemmed from some suggestion that where it seems that people have been infected from greater distances than we would associate with a droplet-based infection. But still, to date, and this is through a variety of methods, including laboratory-based methods where they're able to actually sort of assess how an aerosolized virus travels through the air. The distance that this can travel still seems to be on the range of what we typically associate with droplet-based infections. So I would agree.
Okay, great. Thank you very much, both Dr. Nicholas Vabre and Dr. Keith Siegel.